Here's a quick lesson on ventilator alarms. Ventilator alarms can be intimidating, but with a quick rundown, you'll handle them like a pro. Let's talk about high-pressure alarms. They usually indicate resistance in the system. This could be due to a kink or water in the tubing, the patient biting the tube, copious secretions, or a plugged endotracheal tube. So what should you do? 1. If you suspect secretions, suction the patient. 2. Use a bite block if the patient is biting the tube. 3. Reposition the patient's head and neck, or adjust the tube. 4. Sometimes, sedation is necessary to prevent the patient from fighting the vent. But remember, sedation should only be considered after ruling out any physical or mechanical causes. And that's it. You're one step closer to mastering ventilator alarms. Keep learning, keep practicing, and soon you'll be the calm in the storm. Subscribe for more nursing videos like this.